Today, we're going to dive into an idea that could completely change what it means to recover from cancer. It's a venture called Nexus AI, and it's all built around one simple, but honestly pretty radical question. What if this system designed to save your life also helped you live it?
And the story? Well, it begins right here, with this incredibly powerful admission from its founder, Dr. Liwen Li. You see, this isn't some solution that was dreamed up in a boardroom. No, this was forged in a hospital room by someone who went from being the expert studying resilience to someone who had to live and breathe it every single day.
So, that's what we're going to unpack, how one of life's most terrifying moments, a personal health crisis, can become the spark for a mission with the potential to help millions of people navigate their own journey.
So let's meet Dr. Li. For 20 years, her whole career was dedicated to understanding things like community empowerment and resilience. She was the expert. Then, while living as an expat in Germany, she heard those words that change everything. You have breast cancer. And in an instant, the objective researcher became the overwhelmed patient.
And it was from this new, terrifying vantage point that she discovered a huge gap in modern healthcare, something she eventually came to call the survivor's abyss. Okay, so what exactly is this abyss? Well, it's the giant gap between just surviving cancer and actual survivorship. Think about it. The medical system is an incredible machine for fighting the disease itself. But once the tumor is gone, patients are so often left all alone to figure out this dizzying aftermath of fear, paperwork, and psychological trauma. And Dr. Li didn't just feel this. She systematically identified 12 distinct obstacles lurking in this abyss. I mean, just imagine not only fighting for your life, but at the same time battling administrative chaos, trying to manage the emotional fallout for your family, and living with that constant nagging fear that it could come back. It's like a second, silent battle that starts the moment the first one is supposedly won. And for millions of people, this battle is fought in complete silence. Dr. Li found a massive barrier that most Western healthcare models just totally miss: cultural and language gaps. For huge communities around the world, there are cultural taboos around mental health and illness that create this profound isolation, leaving them without the support they desperately need. But here's the thing. Because Dr. Li lived through this abyss, she didn't just map out the problem. She started to imagine a way out, a new kind of tool designed specifically for this treacherous journey.
And this is the beautiful, simple idea at the heart of Nexus AI. What if, when you felt the most lost, you had a compass? A digital guide right there in your pocket designed to help you navigate every single obstacle, from the clinical to the cultural.
I mean, just look at the contrast here. It's a total shift from a system that actually adds to a patient's burden to one that actively works to lighten it, removing from a fragmented, one-size-fits-all approach to one that's integrated, intelligent, and deeply aware of the human being at the center of it all.
So, how does this compass actually work? The technology is, really, a direct reflection of its founder's own story. It's a unique architecture built on two separate but interconnected engines. The first one is Engine A, the clinical brain. You can think of this as the scientist in Dr. Li. It's built on a foundation of hard data, evidence-based research, and the highest global standards from bodies like the World Health Organization. This part ensures every piece of information is safe, accurate, and trustworthy.
But this is what makes it revolutionary. Engine B is the psychosocial heart. This is the survivor in Dr. Li. It's powered by 2 decades of research, sure, but it's fine-tuned with the irreplaceable wisdom that you can only get from lived experience. This is the engine that understands culture, family, and fear. It's the empathy.
And this entire dual-engine system is built on an incredibly robust foundation. This isn't just some simple wellness app. It's a platform designed from the ground up to meet rigorous global clinical and regulatory standards. That foundation is what creates trust and makes this a tool that both patients and their doctors can actually rely on.
Of course, a powerful mission needs a sustainable plan to make a real-world impact. So how do you take such a deeply personal vision and scale it to help people all across the globe?
The approach here is just as human-centric as the product itself. They started by not building an AI at all. Instead, the founder herself acted as the AI for early users. It's a classic method that let them learn directly from survivors what they truly needed before a single line of code was ever written. Just brilliant. So the next stage of this journey is all about moving from that validated concept to a global reality. And to do that, the team is bringing together the resources they need to build out the technology and prove its impact at scale. And there's a really clear, focused plan for that capital. It's not just about building an app. It's about serious product development, running clinical pilots to get hard evidence of its effectiveness, and navigating all the complex regulatory pathways to make sure it can be used safely all over the world.
You can see the roadmap lays out a very deliberate, methodical expansion. They start with the current validation phase, then move to global pilots to test the Compass in different healthcare systems, and then they prepare for a much wider launch. Every step is designed to make sure this mission grows sustainably.
Which brings us right back to the beginning. This whole story started with one person, an expert on resilience who was forced to live it. By turning her journey through the abyss into a compass for others, she leaves us with a pretty powerful question. Can personal crisis, when it's fused with science and empathy, actually become the blueprint for global change?